Hi, my name is Deb Takama, and this is a short, about 15-minute webinar that I usually do live to my occupational therapists, where we have Zoom calls and I do some explaining and they get a demo kit. And so I wanted to make this public for a couple of reasons. One, because it's right now with the work environment, it's so difficult to get everybody on the same page or in the same room. And so it's just so much easier to make this live so that anybody that wants to access this webinar and understand a little bit better how the Freedomwand works could access it. So a little bit about me. I started this 15 years ago. It's our anniversary. And I broke my back in a car accident, and I was also over 385 pounds at the time. I left the hospital after 6 days in a turtle shell for the next 4.5 months. And when you have one of those plastic corsets, you can't bend or twist. And those of you who have that problem know exactly what I'm talking about. So I had a problem in the restroom, and I wanted to live an active, independent lifestyle. I wanted to be able to leave my home, but when you don't have a tool that's portable or easy to use for your toileting hygiene, you're pretty much stuck at home. And so I looked and looked for something on the market, and my OTs tried to help me find something. But what we found back then was either too short for an obese patient, or it was something I created that was too long to be portable. So I was quite stuck, and I'm like, there's people that live with this their entire lives. What do they do? This is just ridiculous that there's not a tool that could help. And I also wanted to be able to shave my legs, apply medicated cream to a raw bottom due to all the drugs I was on, and wash myself in the shower. Now, you could find some long-handled sponges to do that with, but they were pretty expensive. Some of them are cheaper, but once the sponge got soiled, you could have to throw it away and start over. And I'm like, well, I like loofahs, so I wanted to make something that would hold my loofah. So all of that story tells you how the Freedomwand got started. And like I said, we started 15 years ago, and originally I started with just the master kit. And the master kit comes boxed like this, and it has 3 pieces in it, what we call the handle, the extension, and the head. And it gets up to 20.5 inches. So we started with this one. Then we created the ultimate kit that's packaged like this or in a plastic bag. They either come in a Ziploc bag like this or the box. And the ultimate kit has 2 extensions in it, and also a strap, and I'll explain how that works. But this strap will help you give leverage. It attaches to the handle, and it gives them the leverage not to drop it because it gets extra long when it's 25.5 inches. But this strap is great for many reasons. So then after we created that, we created the compact kit. And the compact kit is our shortest version. They always come in a package like this. They've got the handle and they've got the head. With the compact kit, and all of them come with a cloth carry bag, and we have that so that is very discreet and nobody knows what you're carrying in there. If you happen to be at work or at school and you're carrying this from the bathroom to the sink or something, nobody needs to know what's in there. So that is what they all come with that. So let me show you now how it works. So all of them are interchangeable. They have a push button right here on one piece, and they have a hole on the other. You'll just push this in until you hear it click. So I'll be quiet so you can hear that click. And then once you know it's clicked into place, it holds very well. And then you click the other one, depending on how many pieces you have. Now, to take it apart, you just push this button in and then wiggle and gently pull. Don't pull too hard, because if you pull it too hard and too fast, you might pinch your finger in that button. But when you gently pull, it just starts coming apart. So now you don't have to push the button will stay down, and you can just wiggle and pull it just a little bit so that it comes apart. Very easy. For the demonstration, I'm going to use the compact kit because it's easier to fit on the screen. So the slide bar goes in and out really easy when it's empty. Okay, so you can use the side of your chair, your arm, you can use your leg to push that button in and out. This is the rinse hole right here. When my OTs helped me develop it, half of them wanted a rinse hole in there so that anything that should get up into it could come out. You could rinse it out. And some of them thought that that was going to capture more than what it would help. But if what my patients, if they don't like the rinse hole, they just put duct tape over it. So that's the best option if you don't like it, but if you like it, that's great. That's what that is all about. Now, when you open the grippers and you look inside, you're going to see that there is a diameter in there, that these grippers do not go tight like your fingertips right now. And that is because I wanted it to hold multiple items. So one of the things that I could not do when I couldn't bend or twist is shave my legs. Now, this is a disposable Bic shaver. It wiggles just a little bit, which is really good. So when you're shaving your legs, it's not a firm, gives you the flexibility a little bit. But I wanted it to be able to hold that Bic shaver. And you put it in and load it so it goes with the curve of the wand. And for those pregnant ladies having that precious bundle, having another extension on here works really well for shaving your legs while you can't bend over. Those with back issues, I've had men that have ordered this to shave their backs. I didn't know that men shave their backs. So that was interesting to learn. So that's the shaver part. Then we talk about using a makeup applicator. And I do that because they're a triangle sponge. They're really inexpensive. You can get 100 of them for a couple bucks at Walmart or any place really that sells cosmetics. You put the fatter end in and it will just pinch it and pull it all the way in. This works really, really well for putting medicated cream for diabetic feet, infected feet or toes, hemorrhoids, incision on a back or on someplace that you can't reach that needs medicated cream. This works really well. But if you want a bigger piece of sponge so that you can put lotion on a bigger area at a time, all you have to do is buy some sort of a sponge, like a loofah, maybe a natural loofah. They work really well. Cut it into a triangle piece, and this right here will grip a lot of sponge. So depending on how big you want your sponge that holds your lotion, you can cut that triangle piece and then just pinch all of that sponge deep into the grippers and pinch it in, and it will hold really well and give you a nice round part to be able to put lotion on your back or anything else you might want to do. So that's that part. Then we have the loofah, which is what I like, but now I'm going to admit this is a little more tricky. And I probably should have had a different color loofah with my blue shirt, but we tied knots. Let me get it on a place where you can see. And we tied multiple knots. The key of this and the key of everything is to, when you're loading something, that it's the size of your pinky, approximately 1 inch long, so that you can pull it all the way in and it holds very firmly. Okay. So every loofah that you buy has a rope on it. And some of those ropes are thick and some are thin, some are short and some are long. This happens to be from Walmart, and it's a shorter, thicker rope, but we tie 2 knots on top of each other, not one on top of another like a snowman, but one big knot that's going to be the diameter of your pinky. You pull that really tight, the netting tight, hold it between your body and your kitchen table or something, so that you can get that knot really close to the nylon netting, because the nylon netting itself is too slippery. So it will not hold the nylon netting. You have to grab the knot. I like to go in from the side, and you pinch that grippers around it, and that knot is nice and deep. And you can pinch and push them in as well if you need to. And do the shake test where you let go of the whole wand and you just shake it to make sure it's holding well. And so that when you're rubbing your back in the shower, it's not going to come off on the pressure. So that's the key, is to have that knot really deep in the grippers and pulled all the way in so it holds it nice and tight. Now, the most important part is why everybody buys it. So that is for the toileting. Depending on the thickness of your paper will depend on how much paper you need. Now, the easy way for me to describe how to load the tissue while recording is by folding it and then folding again. This is Charmin extra thick tissue, and we need about 7 squares. So you don't want that rectangle to be perfect, right? You just want it to be messy. Then you grab the middle of it and you pinch it together to make what we call a pom-pom. Okay, now can you see that? Let me see if I get the right angle. See that stem of that pom-pom or that stem of that flower? It's about the size and diameter of your pinky. It's 1 inch long. That's key right there. That is the key. You put it deep into the gripper. You don't want to put it at the fingertips like this, because then it's going to fall right out, right? You want to put it deep into the grippers. You want to make sure that the grippers are pulled all the way in. See, those little grippers disappear in there, and you can fluff this out just a little bit, and now you've got it perfect to be able to wipe your bottom. And you do the shake test again. Don't hold it on the bottom with anything, but make sure you've got it nice and tight. If it's not tight, then it's going to come right out. You're not using enough tissue. So you just want to practice with your tissue and your abilities and your dexterity of what you can do to load that. Now, we do have quite a few caregivers, moms or spouses that pre-make those. So when you order one, the Freedom Wands all come with one already inside. But when you want to make them early and just put them in a Ziploc bag, you can just use a little rubber band like you use for your braces, or little girl's hair, those teeny little rubber bands. It's not going to damage your toilet or septic. And you can hold them together, and you can fit like 100 or so of these in a gallon Ziploc bag, easy enough. And that works really, really well. But again, remember, there's multiple ways to load this. I've had people tell me all kinds of different ways to load it. So it depends on your dexterity and what you like the best. But we just find it's the best just to create that rectangle, create that pom-pom about the size of your pinky, put it nice and deep, pinch or pull it in, and it holds very firmly. And the nicest thing about our toileting aid compared to the others is when it's soiled and done, it just slides right off with the slide of the button. It just falls right off. There's no peeling or pulling anything off. It just slides right off. So that's really great. So that's how that works. Now I want to show you a minute the strap. So we created the strap because our little people asked for the strap. And their little fingers are nice and short, right? And our strength in our fingers is due to the muscles. So if you have a very small fingers, you're going to have not as long of muscles. So the strap is got one hole on one side, and you've got 3 slices on the other. Oh, there you go. 3 slices on the other. And that is for a small, medium, and large size hand. So with your handle, you put the strap over one end, and then you just pull it over your hand and put it through the other to give you the leverage. And that way it will just size whatever size you might need. And then you put the pieces together, no matter how many pieces you want to use it. And it gives you the nice leverage not to drop it, okay? So partial paraplegia, arthritis patients, of course, our little people, you know, the carpal tunnel, there's lots of reasons why. And even if you can hold it strong enough, but you have a hard time bending over to pick it up, this will just give you that extra security that you're not going to drop it. Okay, so that's the strap, and those come automatically in the Ultimate Kit, but they are sold separately. The other thing I want to mention is that all of the products on our website are sold by the piece as well. Now, when you buy a kit, it's cheaper to get the whole thing as a kit, depending on what size you want, the Compact Kit, the Master Kit, or the Ultimate Kit. But we've had a lot of dogs chew these up or chew the grippers up, and you don't have to order a whole new part. Or if you happen to drop this into the public toilet and don't want to reach for it, we've had that happen a few times with people, then you can just order just a part. But you can only get those, well, you can get one, the head, I think, and the handle on Amazon, but otherwise on our website, you can get all the parts and pieces that you need. And with that, I think we're good. Our biggest concern that people have is understanding and giving themselves the amount of time needed to learn how to properly load it with the toilet tissue they like to use. It also works very well with wet wipes. We recommend the Huggies thicker wet wipes, or any wet wipe that's a thicker, and then you probably need to have 2. And if you don't, you put them on top of each other, but you kind of fan them so they're not right on top. And then again, you grab the middle, you pinch it and make that pom-pom. With the wet wipes, make sure it's nice and firmly tight, because the wet wipes all have a solution, a soap solution on them. And of course, soap makes things slippery. So you want to make sure that you have a nice firm hold when it's deep into the grippers, because of that slippery. And then you can get them that are also flushable. So that I think is going to answer most of your questions. And we look forward to hearing from you. We are here in the office every day. There's just a couple of us that answer the phone, so you may have to leave a message and we'll get back to you. But we are here to help you and to walk you through it. I've been doing this for 15 years now, and I basically definitely have heard it all. So I was there with you. I know exactly how you're feeling when you have a hard time reaching, and I'm here. We are just here to help you figure it out and live an active, independent lifestyle with dignity. Thank you so much for joining us. Thank your OT for all that they do. It is imperative that they teach us how to be an active person, an independent person when we have those limitations. So thank you again. Have a blessed 2022 and stay safe. Bye now.